When children are born with heart abnormalities that involve the electrical system of the heart, cardiologists use many tools to detect and often treat the problem without surgery. Dr. Anjan-Batra of Children's Hospital of Orange County explains the successful treatments for these potentially fatal defects.
There is an electrical mechanism, there is a powerhouse within the heart that generates the electricity where it originates from. And then just like anywhere when you have to take electricity from point A to point B, there are wires that take that electricity. So just like that in the heart, there are specialized wires or specialized cells that take that electricity from point A to point B. The normal conduction going, originating from a certain area, going down specialized nerve fibers and going all the way down to the lower chamber. When you hear a heartbeat, you hear two heart sounds, lumped up, lumped up. Basically, it's the upper chamber contracting first, there's a pause, and then the lower chamber contracts. And the electrical wire or specialized cells take that electricity from the upper to the lower chamber. There's supposed to be one area of connection between the upper and the normal and the lower heart, what we call the AV node, or the atrioventricular node. Sometimes what can happen is there can be an additional area that is also capable of conducting this electricity from the upper to the lower chamber. So what if you have an extra wire or extra nerve cells conducting electricity? No big deal. Most of the times, not a big deal. But if you imagine two wires that are capable of conducting electricity very close to each other, current, instead of going from the upper chamber to the lower chamber, can actually form a short circuit between the normal and the abnormal. And the current goes in a circle between these two at a very rapid heart rate. And normally when your heart rate is 60 or 70 beats a minute, all of a sudden it speeds up to 200 beats a minute. So if you understand that, then you know what the treatment for this is, and that is to go ahead and get rid of this extra nerve. That can be treated with very easily in today's day and age with what we call an EP study or an electrophysiologic study and radiofrequency ablation. We go inside, we find where this extra nerve is and localize it. Once we've localized it, we deliver a small amount of energy on this very small area of cells, about the size of a hair particle, and get rid of that extra nerve. The success rate in today's day and age for an EP study and RF ablation are approaching anywhere between 90 to 95% successful. And of those 5 to 10%, the reason they are not successful is not because we can't do it, but because we choose not to do it. We talked about the normal and the abnormal nerve, being close together and trying to go after the abnormal nerve. If they're too close to each other, then you risk damaging the normal nerve if the two are very close to each other. And if we do find when we go inside that the two are very close together to an extent that it may potentially risk the normal nerve, then we opt to not go after it. There's a lot of new ways of delivering energy to get rid of that extra nerve. We talked about radiofrequency ablation, which is the standard of care today. And radiofrequency ablation basically heats the tissue. There are other things that can cool the tissue and have a similar effect. With ablations, we've come a long way, but new things keep coming, and hopefully we'll do better and we'll see where we get 10, 20 years from now.